The American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. Major medical advances are made each week, and each week the American Health Journal keeps you up to date.
Now, here's our host, Chris Long.
We go now to Laura Windsor with a report on enhancing your smile.
A white, bright, and healthy smile can make someone look years younger. Premier Beverly Hills cosmetic dentist Dr. Karush Maddahi explains a cutting-edge procedure that marks a pinnacle in age-reversing dentistry called the smile lift.
When I sit down with a patient and I'm doing an examination, I don't actually look at their teeth first. I look at their face. I look at the sort of the discrepancies between the upper and lower lip. I look at if the face has a hollowed look to it. Is one side going in more than the other? Are there lines at the corner of the lips? So I make notations of all the things that I see actually just looking at someone's face. And then the next thing I do is I ask them to smile to see if there is an actual reason that is dental related. As you get older, the actual support of the lip and the cheeks comes from the teeth, not anywhere else. Whereas when you are younger, the fat within and the collagen within the lips and the cheeks is what is the main supporting aspect of the lips and the chin. So when we're talking about a smile lift, is for someone whose teeth are too far inward, the arch is too narrow. By putting the proper arch and proper position of the teeth, the whole lips and the cheeks starts to lift up, and person has a much better looking smile, a much better looking face as a result of it. There are actually three options that a person has to sort of look at their teeth, how it's going to end up before they actually do the work. Option number one was the cosmetic imaging. So we would use the computer and we would put, like as if they are getting crowns or veneers, onto their teeth, and they could see it. In a matter of 15 minutes we could sort of Photoshop the new teeth onto their smile. So that was the cosmetic imaging side. The second choice was to do wax up of teeth. What that means is that we would take a model of how the teeth looks, and then we would use wax on top of it, and if the person had teeth that were crooked, with the wax up we would show them exactly on a model how it would look. And the third option is the smile lift, the 3-minute smile that we would show as how would the smile lift work on that person's face. So I wanted to show you an example of what the 3-minute smile is. It's a sort of a plastic teeth, and it comes in 2 different shades, and it comes in sort of 3 or 4 different sizes. So we put it over someone's teeth and we temporarily glue it on there so that they can actually take a look at their smile as if we were doing the work. As a part of the smile lift, if a patient has a narrow arch, what we do is that in the laboratory we can add wax to the outside of the teeth to enlarge the arch of the person. So when they actually are smiling, they will have a much wider looking smile. From the point that we start the procedure to the end is about 2 weeks or less. We're talking about only somewhere between 3 to 4 appointments. This whole thing with the cosmetic dentistry and then the anti-aging dentistry is a whole type of a new thing even for me. The satisfaction that I get and the satisfaction and the happiness that I see in my patients' faces. They're looking forward to coming to the dentist. They're looking forward to getting this work done. They look forward to having a brand new life, and their confidence level and all of these things changes, and that is amazing.